Let's discuss in this video medical gases, one of them like oxygen. Oxygen is manufactured commercially by fractional distillation of liquid air. Before liquefaction of air, carbon dioxide is removed and liquid oxygen and nitrogen separated by means of their different boiling points. For example, oxygen have minus 183 and nitrogen have minus 195 grades of Celsius. Oxygen is supplied in cylinders at the pressure of 137 bars and plus 1, which is atmospheric, and it is considered 138 when you see anywhere in the, as indicated, 138. So approximately 2000 of lb in at square at 15 grade of Celsius. In the UK, the cylinders are painted black with a white shoulder. Many institutions use piped oxygen, and this is supplied either by a bank of oxygen cylinders, a lot of oxygen cylinders ensuring a continuous supply, or from liquid oxygen, or premises using in excess of 150,000 of liters of oxygen per week find the latter more economical. The presence of oxygen in the hospital in a hospital pipeline is approximately 4 bar. Which is the same as the pressure distal to the reducing valves of gas cylinders attached to anesthetic machines which we are using. So how about oxygen concentrators? Oxygen concentrators produce oxygen from ambient air by absorption of nitrogen onto some types of alumina silica called. Oxygen concentrators are useful in both in hospitals and in long-term domestic use in remote areas, in developing countries and military surgery. The gas produced by oxygen concentrators are small quantities of inert gases which are harmless at all. Want to add some information regarding properties of the oxygen. It is a tasteless, colorless, and odorless, with a specific gravity of 1.105 and a molecular weight of 32. At atmospheric pressure, it liquefies at minus 183 grades of Celsius, but at 58 the liquefaction temperature increases to minus 119. So many properties we discussed regarding oxygen, and very interesting for us doctors and of course for patients are side effects or adverse effects of oxygen. Fire. When you're hearing oxygen, you are thinking about fire. Oxygen support combustions of fuels. An increase in the concentration of oxygen from 21%, which is atmospheric, up to 100%, causes a progressive increase in the rate of combustion, with the production of either conflagrations or explosions with appropriate fuel. So for creating a fire, oxygen requires also fuel. Without fuel, no fire. Oxygen have some effects on organ system, but not so pronounced. For example, on cardiovascular system, an increase in arterial oxygen pressure leads to direct vasoconstriction, which occurs in peripheral vascular and also in cerebral, coronary, hepatic, and renal circulations. This effect is not manifested at partial pressure less than 30 kilopascals. Or if to transform in millimeters of mercury, multiplying by 7.5, sorry guys for this, it could be around 220 millimeters of mercury pressure. So less than this pressure applied is not manifested with vasoconstriction, and assumes clinical importance only at hyperbaric pressure of oxygen. Hyperbaric pressures of oxygen also cause direct myocardial depression. Does it affect lungs? Yes, absorption atelectasis called. Because oxygen is highly soluble in blood, the use of 100% oxygen as the inspired gas may lead to absorption atelectasis in lung units distal to the site of airway closure. So absorption atelectasis has been demonstrated in volunteers breathing 100% oxygen at forced residual capacity. Atelectasis is evident on chest radiography for a period of at least 24 hours after exposure. Pulmonary toxicity is another fact that is determined, and chronic inhalation of a high inspired oxygen concentration may result in the condition termed pulmonary oxygen toxicity, which is manifested by hyaline membranes, thickening of the interlobular and alveolar septa by edema and fibroblastic proliferation. The clinical and radiological appearance of these changes is almost identical to that of the acute respiratory distress syndrome. Almost identical. Biochemical mechanisms underlying pulmonary toxicity. So, oxidation of SH groups on essential enzymes such as coenzyme A, peroxidation of lipid resulting in lipid peroxides inhibits the function of the cells. So enzymes like peroxides inhibit the function of the cell. Inhibition of the pathway of reversed electrotransport, possibly by inhibition of iron and SH containing flavoproteins. These changes lead to the loss of synthesis of pulmonary surfactant and encouraging the development of absorption collapse and alveolar edema. Central nervous system oxygen toxicity, convulsions similar to those of grand mal epilepsy occur during exposure to hyperbaric pressures of oxygen. Retinal vasoconstriction with obliteration of the most immature retinal vessels and subsequent new vessel formation at the site of damage in the form of proliferative retinopathy. Leakage of intravascular fluids leads to vitreoretinal adhesions and even retinal detachment. And hematopoietic system, long-term exposure of elevated fraction of oxygen leads to depression of hematopoiesis and, of course, anemia. Want to safe to use it, we are using in a large or widely in the intensive care, especially as most of the patients require oxygen supply. Of course, in anesthesia, we are giving some increased fraction of oxygen like 40 to 50%. If you are not giving any of the setting of oxygen fraction, the anesthesia machine or even a manual ventilation will give 21% fraction of oxygen, which is from the atmosphere. Thank you for watching, guys. Have a great time.